we had adopted Dr. Cheng's work towards looking at the penetration, developing a platform to how better to deliver chemotherapy to the mucin-producing cancer cells. You've seen the pictures of the mucin. It appears, and this is a real challenge. How do we better deliver the chemotherapy? And what Hal put together, and with Marion's assistance, we were able to modify the surface of these nanoparticles with pegylation, and Marianne is going to discuss this, about how to make them slippery, so that when we give the nanoparticle, how is it can find its way through the mucin and to deliver what will be in the future chemotherapy which is associated with the nanoparticle. Marianne has really taken this to the next level, and she had just recently presented this at the Regional Perfusion meeting in Phoenix, Arizona, and it did a remarkable job, and we are looking forward to seeing what we do we just submitted this for publication. Marion's in her final year in the laboratory. She's done a great job. She's been, as I mentioned before, enormously productive, and I'm very excited to share our research, which has been funded by the ACP-PNP Research Foundation, and because of the ACP-PNP Research Foundation, this work has been made possible. Dr. Marianne Khalili.
Thank you, Dr. Brown, for the introduction. Thank you for inviting me to speak. Thanks for this opportunity to present our work, and thank you to the ACPMP, Jahan, Kim, Melissa, everyone who organized this, and the board of ACPMP. Thank you. So I'll be discussing the delivery of anti-cancer agents through mucin. So my talk is titled Slippery Nanoparticles as a Diffusion Platform for Mucin-Producing Gastrointestinal Tumors. We have nothing to disclose. We did receive funding for this from ACPMP through NORD, but no financial disclosures. Well known to this audience, pseudomyxoma peritoni is characterized by large pools of mucin accounting for over 50% of the tumor area. And traditional therapy includes cytoreductive surgery, tumor debulking, intraperitoneal systemic chemotherapy. Treatment failures are in part attributed to the ineffective delivery of therapeutics through this dense mucinous barrier. And so what is mucin? It's a viscoelastic gel that protects tissue that's exposed to the external environment. So this includes the respiratory tract, the GI tract, the vaginocervical tract, the eyeball, and it does a very effective job in trapping particles. This includes most nanoparticles, particularly polymeric nanoparticles. And this is through both steric obstruction and adhesive interactions. And so what investigators have done to overcome these steric and obstructive interactions is that they've added a charged layer to the outside of these polymeric nanoparticles, and that's polyethylene glycol. So this is a single pegylated nanoparticle here, right there. And what we've done is we've modified this single pegylated nanoparticle with a lower density second pegylated layer to make them more slippery. So this is able to interact with the mucin in such a way that it's able to kind of slide through the cracks and get to the bulk of the tumor. And our specific aims were to study the diffusion of our double pegylated and single pegylated nanoparticles through mucin in vitro using a transwell system. So we looked at the diffusion of these particles through cultured LS174 T cells. These are human mucin-producing colon cancer cells. And we also looked at their diffusion through patient-collected pseudomyxoma peritoni tissue. We also looked at an ex vivo rat intestine model, just looking at the diffusion of these nanoparticles through the mucin in the rat intestine. And we also looked at a murine xenograft subcutaneous tumor model. So this is our transwell system depicted here. So over here, we have an inner well that's placed into an outer well, and the bottom of this inner well has pores. And we have either LS174 T cells or PNP tissue inside the inner well. Our nanoparticles are DID labeled, so they have a fluorescence signal on them. And what we could do is look at the diffusion of these nanoparticles through the inner well into the outer well. And we could actually measure the rate of diffusion by measuring the amount of fluorescence in the bottom well over time. These wells were placed on a shaker, to mimic the biologic system while we were doing this diffusion study. And this is our results with the LS174 T cells under shear stress conditions. So the first image here has static conditions. Over here we have shear stress conditions. And under shear stress conditions, you could see a difference in diffusion rate with the double pegylated versus the single pegylated nanoparticles through the LS174 T cells. Similarly, with the PMP tissue, under shear stress conditions, we saw nearly 100% of the nanoparticles diffusing through after 8 hours versus only 40% of the single pegylated nanoparticles in the same time period. Next, we looked at the diffusion of nanoparticles in an ex vivo rat small intestine model. And here, rat small intestine was collected and submerged in a solution of fluorescence DID-labeled single or double pegylated nanoparticles for 30 minutes. We placed these tissues on a shaker, again, to mimic the biologic system. And we sectioned the tissue to look at it with confocal microscopy. So this is immunofluorescence here. In the first row up top here, we have the single pegylated nanoparticles. Down here, we have the double pegylated nanoparticles. The DID label, which indicates where the nanoparticles are, is green. The blue is just the nuclei. And we can see with the double pegylated nanoparticles, we see better diffusion of the nanoparticles through the intestinal mucosa. The last part of our study was looking at a murine xenograft tumor model. We developed a subcutaneous tumor in LS174 T cells. And then after we had established this model, we waited for these tumors to be at least 300 millimeters cubed in size. And we injected them supratumorally. So we did a subcutaneous injection on top of the tumor with our nanoparticles, so either single or double pegylated nanoparticles. We waited 30 minutes, and after 30 minutes, the mice were sacrificed and the tumors were collected and cryosectioned. This is just looking at an H&E of the tumor. It's showing that there is both intracellular and extracellular mucin in these tumors. This is how the tumors were cryosectioned. Of note, we have superior, middle, and inferior sections. And this is our result of the cryosection tissue. In the top panel, we have the single pegylated nanoparticles. Bottom panel has the double pegylated nanoparticles. As you can see with the single pegylated nanoparticles, there is barely any signal in the inferior section, and all of the signal is aggregated peripherally. With the double pegylated nanoparticles, we see that there is DID signal, green DID signal, indicating the nanoparticles distributed throughout the tumor sections, going all the way to the inferior section. This is the same image, but over here we're just looking at the DID signal, so we're only looking at the nanoparticles themselves. And we get a better idea of how it's aggregated here, and really there is very little signal in the inferior sections. But with the double pegylated nanoparticles, you see it going throughout the tumor, and it's just very well distributed. It's diffused throughout the entire tumor. And graphically, we could see here that there is a significant, so the blue here is the single pegylated nanoparticles on this graph. And then we're looking at the red here, which is the double pegylated nanoparticles, and we have the superior, middle, and inferior sections. And there is a significant difference in the fluorescence signal with the single pegylated nanoparticles in the superior versus inferior section, signaling that there wasn't really diffusion going all the way down to the inferior section. But there's even distribution of the double pegylated nanoparticles throughout the tumors. So in summary, we were able to show that there was superior diffusion of our double pegylated nanoparticles compared to the single pegylated nanoparticles in LS174T in human PMP tissue, in an ex vivo rat small intestine model, and in a murine xenograft subcutaneous tumor model. So our double pegylated nanoparticles can be an effective diffusion platform for mucinous matrix for PMP, and can be an effective anti-cancer drug delivery system. So in the future, of note, this is a pretty platform study. We have to look at the diffusion of these nanoparticles in various cell lines, because every cell line has a unique microenvironment. We also have to show treatment efficacy. So we actually have to encase our anti-cancer drugs inside these nanoparticles and see if we see a treatment improvement using these nanoparticles. And we hope to show efficacy of the nanoparticles with both intraperitoneal and IV administration. So that's it. Thank you.